Well, I think it's a very important concept. So it means delivering care as best as we can within the resources that we have and be very efficient about it. Yes, of course, there's challenge in terms of applying green healthcare to any disease, and that includes asthma. So obviously, we're talking about delivering healthcare to the maximum number of patients with asthma, if you're talking about asthma, and if you have limited resources and limited means of doing it, that presents a challenge. But I think there's been various ways in which this challenge has been addressed. I mean, for asthma, for example, we know that there are now guidelines that most doctors use, and those guidelines are used to help doctors to deliver the best that they can for most patients with asthma. And at the end of the day, one of the things that's very important in terms of delivery of care to patients with asthma is that we need to get the maximum patient satisfaction as possible. And I think this is possible through the use of those guidelines. And in fact, I just want to give an example. For example, in asthma, we really put a lot of emphasis on self-management plans. And that's an important aspect because patients with asthma very often gets worse quite suddenly. And if we teach them how to cope with those situations, that's going to be a very useful step for patients to be helping themselves. Well, so one of the areas of interest that I have is asthma, and particularly in terms of management of asthma. And I'm particularly interested in those people with asthma who have what we call now severe asthma, and these are patients who do not respond to the asthma treatments that we have at the moment. And in those patients, one of the things that I'm particularly interested in is to understand whether there are different types of asthma within that group, so that we can, in fact, target the right treatment to those different types of asthma, and we call that phenotypes. And this is really going into now a different aspect of management, which is which we now call precision medicine. And in fact, precision medicine is something that's now getting into various areas of medicine, including asthma, and it's a very exciting area to be involved in. Well, like many things in life, I mean, things happen accidentally, and it wasn't my first choice to practice respiratory medicine. I think, if I remember correctly, I always wanted to do cardiology, but as it happened, there was a position available at the time when I was looking for various jobs, and that's how I ended up in respiratory medicine, and it's without regret. Well, I think my suggestion for young doctors who haven't decided, what they're going to do in a professional career, and what career they want to do, or what specialty they want to choose, is to really decide for themselves, looking around and what they feel is going to be the path that's going to be most satisfying to them. I think that's something that everyone needs to do for himself, and of course get the advice of other more established people in various specialties, and see for themselves which one would suit them best.